It is 4:53 a.m. and this is my 5 a.m. morning work routine as a dental hygienist. So I always start off my morning before I brush my teeth. I don't know why I like to take a little rinse. I'm gonna go in and brush my teeth. So my toothbrush that I use is my Sonicare toothbrush, toothpaste. Now that I'm done brushing, I like to finish, well, now that I'm done brushing and flossing, I like to finish off with a rinse. And this is the one that I like to finish off with, the Crest. All right, y'all, we just finished our workout, so I'm about to shower and head to work. All right, y'all, so the gym I started going to is actually right next door to my office, so it's perfect. I came right over. So you see me getting ready for the day. I'm currently in the laundry room. We keep all of our lab jackets right here in the office, and I usually like to wear these. I do have some of my own, but these ones, we have a washer and dryer, so we keep them right here, handy dandy. So it's just so much more convenient for me to come in and put these ones on. Next, I'm gonna go ahead and get my headset and get my radio hooked up. Now, these we do use throughout the office. They are very, very convenient. We have a pretty big office. We have lots of workers here, so we want to make sure that we can communicate with each other. So these help out so much, you guys. I don't have to chase people down when I need things. I don't have to chase down the doctor because I have this headset that I wear all the time. Yes, it can be a little bit disrupting sometimes when I'm working with my patients. I want to make sure that I'm giving my patient the undivided attention that they deserve. So all I'll do is just take my headset out just for a moment. But before I do that, I'll let my team know. All right, guys, so now I'm gonna go ahead and just get ready for the day. So I'm getting my mask on. Before our day gets started, we do have a morning huddle. So here in my office, we do morning huddle, and that's basically just a team meeting every morning. It's pretty short. It can be like 10 minutes long, where we just go over the schedule and we discuss the patients that we are having today, and we discuss any treatment that the patient maybe needs from last visit that they never scheduled for, or we just go over any special notes that we know from our patients. So this is just a good opportunity for me to just look through my patient's charts, read through the notes from their last dental visit, and just make sure that I'm prepared for my day and prepared to treat each patient individually to their needs. So I make sure that if there's any special notes, any medical history notes, any outstanding treatment needs, all of those things, I'm going to make sure that I write them down in the morning before team huddle, before morning huddle, and make sure that I let my team know so that they're also prepared to treat the patient. All right, guys, so I'm waiting on my first patient. It's a new patient. They're supposed to come here 15 minutes early for paperwork, but it's 8:15. Their appointment started at 8. So kind of just waiting on them to get done with paperwork and then get done as much as I can this appointment. All right, y'all. So my new patient ended up being set about 20 minutes late. So what you see me doing is just getting the panoramic x-ray machine set up. This x-ray machine basically just takes a full image of the patient's mouth. We can see any impacted teeth, any fractured teeth, like maybe some root tips that may be remaining in the patient's bone that we wouldn't be able to see in the mouth just by looking. So this is a pretty cool machine. We do this x-ray about every 3 to 5 years. This machine, this particular x-ray we do at no charge here in my office, just because it's a quick picture, and also it's just to make sure that there's nothing major going on. Doctor can't really diagnose cavities just by using this machine alone, so we do it no charge. So I'm going to go ahead and take my patient's panoramic, and then I'm going to sit them in the room and take the full mouth series. All right, guys, so I just took my patient's full mouth series. Now I'm getting the scanner set up. So for our new patients, we do a pano, a full mouth series, and an iTero scan. So I'm getting it set up. So I always start on the upper. So you could just flip through bottom or top. I'm going to start on her upper. All right, y'all, so I just got done with my new patient. It's because she was running 20 minutes behind with her paperwork. Now I'm running 20 minutes behind to my next appointment. Well, I'm really running like 16 minutes behind, so I have to go grab my patient. Good thing my next patient, she's not due for any x-rays exam. Just gonna do her cleaning and fluoride, and then she'll be all set. So guys, it is a struggle already this morning. Pray for me. All right, y'all, so I'm actually still running back behind because I have to print my patient's treatment plan. So what a treatment plan is just something where we review everything that the patients do with the patient, and we just show them it on a paper so that they can see what their insurance is covering versus not covering, and then we have them sign it. And this helps because I don't know, the patients, they don't like surprises. They don't like to go up to the front desk and be like, okay, here's your huge fee for today. I think it has helped a lot. So I just printed that. Let me go get it and let me go get my patient. All right, y'all, so I just got done with my patient's prophy or dental cleaning. So I'm going to get ready to schedule my patient back for her 6-month recare appointment. You want me to write that down on an appointment card for you?
I just put it in mine.
Okay, perfect. So yes, Wednesday, July 10th at 11:30. And then let me grab you a goodie bag, okay? And then I'll just make sure that the girls are ready to get us checked out. So we should be all set in just a moment. Do you have any other questions at all for me? Okay. All right. So yes, guys, I do scheduling. It's pretty easy to schedule my patients back. And the reason why we do the scheduling here in the office is just we found that the patients are more likely to come back when the provider schedules them. All right, y'all. So that was like my morning rush. I had the new patient, and then I had a prophy right after. So my new patient needed a deep cleaning, so I actually didn't do any cleaning for her today. I just did like all the x-rays, exam, Perio charting, and she has a waiting period, so either she's gonna be scheduling back for her SRP in July, or I think she might come in just for like a polishing before July. Now I technically had 2 rooms dirty, but my hygiene assistant helped me clean the other room that I hopped out of with my new patient, and now I'm just gonna clean up this room that I just got done with my prophy in. like I had previously said, my first patient of the day was a new patient that, like I said, needed a deep cleaning. So basically what that means is the patient has chronic infection of the gums, also called periodontal disease. Basically, I found that the patient has 5 millimeter and greater pocketing. If you're already a dental hygienist or if you're already in hygiene school, you probably know what that means. But if you don't, I believe I discussed this in another video. But basically, just meaning that the patient has bone loss around the teeth, so therefore the patient needs a deeper cleaning. And the way that I go about that is once I'm done taking my diagnostics, my X-rays, and my scan, I do a periodontal evaluation where I measure around the patient's gums. And after I get those findings, if I am finding periodontal disease, I go to the doctor and I do a preheat. And I just kind of let the doctor know what I found so that he can come in and actually diagnose it, guys. Because as hygienists, we are not allowed to diagnose, but obviously we know what periodontal disease is, but we need our doctors to come in and confirm. So now, obviously, guys, this is our sterile room. This is where I bring all my dirty instruments. So we have the ultrasonic and we also have the autoclave. So this is the process that we put our instruments through in order to get them sterilized. I'm just showing you guys here my hygiene setup. And I always, we keep all of our trays there in that room because we don't have an abundance of trays. And we keep up with keeping the tray stock, and so does our hygiene assistant. Well, I will say mostly our hygiene assistant, but sometimes if I have downtime, I will also do some trays. But yes, we keep all of our instruments and all of our trays in the lab. We try not to stock them in our rooms because we don't have it in abundance. I know in some offices, you're able to stock your rooms with trays and instruments, which is really, really nice. We just do not have that ability here in this office. All right, y'all, so I have a little bit of a break because I had a cancellation. So before I go and do my notes, I'm gonna eat something really quick because I'm hungry. All right, now I just ate some breakfast. Now I'm gonna go ahead and do some notes and put my 2 notes in that I'm missing from the morning because I was so busy. And then my next patient comes in about 30 minutes. So I got some time. So y'all, this day ended up being a pretty chill day because I had some cancellations. I had some openings in my schedule. So if you guys would like to see me on a busy day, make sure you comment down below so I can attempt to do that. But when it gets crazy, guys, it is so hard to film. But anyways, so I'm doing my notes right now, and typically what I do, because, sometimes I don't get to my notes till the end of the day. Like, let's just be real. Sometimes they're super busy. Sometimes I'm even double booked. So what I'll do is when I'm with my current patient, even if I don't have time to write the whole note, I'll write significant notes, like just, bullet points almost about the patient, about what we talked about. Number 1 would be, the medical history. Number 2 would be if the patient was having any pain and what the patient and doctor talked about. All right, guys, so I am in the middle of my 11:30 patient. I'm waiting on doctor to do an exam. He was having pain on his upper left side, so I took a PA and a bite wing of that, and I'm gonna have the doctor come in and check him. He's a perio maintenance, so he wasn't technically due for an exam, but we're gonna get one today because he's having some discomfort. I had some time in between him because my patient above him had canceled. My patient before him had canceled. So what I had done was my notes, and then actually on the doctor's side, they had a new patient who had came in with pain, but we converted them to what we call a comprehensive exam. So that's when we take all the x-rays, kind of treat them like a new patient on hygiene side. So I went over there and I did the perio charting for the patient. He needed SRP, so he needed a deep cleaning. So I treatment plan that, put it in his chart, all the things that he needs to get him taken care of, get his gums taken care of. So yeah, guys, that is how my day is going. After my 11:30, once doctor's done with the exam, I'll do my note, clean my room, and get ready for lunch. This is how my day is going so far. It can be pretty busy. Thankfully, we have a hygiene assistant, but even with that, we only have one, so it still gets crazy. So yeah, guys, I'm kind of hanging out like in our hygiene closet to like talk to you guys because I don't want to be talking in front of the patients and stuff. So all right, guys, so I had just finished up with that periodontal maintenance patient. And for those of you who don't know, a periodontal maintenance patient is a patient who has periodontal disease. So they're on a periodontal maintenance schedule because that means we already did a deep cleaning and now we're just trying to maintain the periodontal disease. So typically those patients are coming in about every 3 months. So yes, guys, you see me again just cleaning up my room. This job can be a little bit repetitive, okay? You're gonna see that's pretty much what the day consists of. We do our cleanings, then we do our cleanings, we get the doctor for the exams, and then we clean the rooms, and then we set up the rooms. It can be repetitive. I find that what has helped me the most with the repetitiveness is having a mix of procedures in my schedule. So having prophies, periodontal maintenance, and deep cleanings so that I'm not doing the same thing all day long. So y'all, now what I am doing is just folding up these sterile boxes, and you can see I am struggling, baby. But yeah, guys, we pretty much have red bags throughout our office because everything that we're touching is pretty much non-sterile. There's a lot of saliva, there's a lot of blood. So we use a lot of these boxes. As you can see, we kind of have them stacked up and we're like running out of space. I feel like the boxes are so small. The people that come to collect them just, they come a lot, but we still need them to almost come like every 2 days. It's so crazy. But yeah, guys, we go through a lot of this, okay? And guys, don't judge us for this room. We have a big office, lots of people, but little space. Y'all, so I already went to lunch and now I have a little bit of downtime before my next patient. So like I said, when I have downtime, I do like to help with making some trays. So that's what I'm doing. Like I said, we keep everything in the lab. So that drawer that I just opened has everything that we usually put on our trays. So that is going to be what you see: the patient napkin, the prophy angle, the prophy paste, the air water syringe, the suction. I usually put about 3 gauze and then floss, okay? Now, if we have it all through the sterile machine already, then I'll also put on there a Cavitron tip and a pack of instruments. But this is our basic tray setup, especially because each hygienist likes to use different things. We don't all like the same instruments. So I just use the basic setup for now. There are 3 different hygienists here in the office. And now, you guys, what you see me doing is I'm going to do sterile. So again, because I have some downtime, I'm going to make sure that I'm keeping the instruments running through the autoclave and running through the ultrasonic as much as I can. Being a hygienist, this is not always easy. We're busy. When we do have some time to ourselves, of course, you want to, do your notes. But I would just say it's so important as a hygienist to be a team player, guys. Make sure that you're helping out everywhere in the office. It makes things run so much smoother. I feel when all hands are on deck, we can get the job done and make the load lighter for everyone and not just ourselves. So, y'all, I officially only have 2 more patients for the day. I'm excited. I'm gonna do my note for my last patient that I had. My last patient was just a prophy, fluoride, and oral cancer screening, so I got him taken care of. And now I have another cancellation. It was never filled, so I'm gonna go ahead and see if anybody needs my help during that downtime and probably make some goodie bags. So let me do this note and then I'll show you guys how I make my goodie bags. So this is our hygiene closet, and again, like we do with our trays, we try to keep goodie bags in stock here. Again, typically our hygiene assistant keeps up with these bags for us. But like I already said, when we have downtime, we need to help out. So I try to make sure that I'm doing these, you know, keeping them in mind to do them as much as possible. But basically, all that we put in our goodie bags is a toothbrush, toothpaste, and floss because we are cheap. No, I'm kidding. But no, honestly, I do kind of think so. Like, we don't have like a bunch of special things. Like, the only other thing that I will put in my goodie bag is when my patient needs like floss threaders, or, you know, like little bottles of, not me yawning like that, sorry y'all, but little bottles of Listerine. But we don't have a lot of that stuff in stock right now, but we also had some issues with our orders and all this. So the basic things that I put in is a toothbrush, toothpaste, and dental floss. And honestly, y'all, half the time, are the patients using the dental floss? I don't know. And I also always recommend my patients use an electric toothbrush. So I always feel a little bit about giving them their manual toothbrush and their goodie bag. But I just let them know, hey, let this be your traveling toothbrush, or use this, you know, for your guests when they come and visit. But, you know, definitely make sure that you're recommending electric toothbrush to your patients. They remove so much more plaque than our manual toothbrushes will. So I always stress that. All right, guys, we made it. 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 Guys, I just got done with my last patient of the day. Yeah, I'm super excited. So I'm cleaning up my room for the last time today. I'm gonna finish my notes and I'm gonna peace out of here. This is how you know it's the end of the day, when you have 2 different gloves on. You don't even care anymore. You're like, whatever. Hey Denise, this is our hygiene assistant. So she is helping me with my last cleanup of the day, you guys. I appreciate her so much. It's so helpful just having 2 hands on deck and just getting the job done, especially at the end of the day. You just want to do your notes and get out of there. So I'm so appreciative of her. She's so helpful. Guys, if you don't have a hygiene assistant in your office, it's still very doable to do it on your own. But I won't lie that having her is so helpful. It has been such a joy having a hygiene assistant. And I have been a hygienist for almost 8 years now, guys. And this is my first time working in an office with a hygiene assistant. And I've only been here for a year. So. Okay, y'all, we are officially done.